put in this computer, and then, okay, 1 second, and go live. There we go. And you'll just see in the top corner, it says live preparing. And there we go. We are live on Facebook. Good morning, everyone. It's still morning. Welcome to another talk of Fertility Talk on fertility solutions. Today we are talking to Professor Kruger from Aevitas Fertility Clinic, that's in Cape Town. Thank you for joining us. We normally have a 2 o'clock afternoon, but I thought let's, Professor is a very, very busy man, so we are really grateful that he could be here today and chat with us. Today we are going to touch a bit about pregnancy loss, infant and pregnancy loss. And we're also going to be talking about male infertility. So we'd like to thank the professor for being here and agreeing to do this with us. We are really appreciating. We are almost 17,000 women on this platform. So yeah, just to be able to speak to a fertility specialist, even if it's just a few minutes, we are really grateful for that. So thank you very much, Professor, for joining us. And yeah, we are grateful to have you here. You can go ahead, Professor.
Thank you very much for the invitation. Much appreciated. I would have been available at 2 o'clock in the afternoon usually, but my good wife's birthday today, and I respect her wishes, and we have a few plans this afternoon. So thank you for changing the slot. You asked me to talk about two topics, two very big topics. So I will do a summary on the repeated pregnancy losses, because that was not really planned.
Yes.
But we can always later, if there's interest, do it in a more advanced way, deeper way. So repeated losses, the literature says if someone suffers from two or three losses, two is, according to the literature, still okay, but I think not wrong if you seek help when there's two losses. Three losses, definitely you need help, and one must get evaluation. So what will the doctor do? He will take a very good history, and he will make sure that your lifestyle is good. If you're overweight, you must lose weight, because that causes losses. You must be tested for diabetes, for underfunctioning of thyroid, but you must go on a strict balanced diet, so that one can achieve a weight that will help you to keep your pregnancy.
Yeah.
Other lifestyle issues very common in these days are smoking, alcohol misuse, drugs, or over-the-counter medication that's not cleared for pregnancy. And many patients use a lot of medication that is really not healthy and can be toxic, and one must detox the system and focus on a good balanced diet with lots of vegetables and fruit and water. So one must not underestimate also the impact of coffee. There are certain patients taking 4, 5, 6, 7 cups of coffee or British tea, Chinese tea. Not good. If you go below 3, your chance for a miscarriage is significantly lower. There's a British study on that. So that's broadly lifestyle. Then the doctor will see you, we will do blood tests, and I'm just summarizing now. There are clotting factors that can be wrong, that must be excluded, like factor 5 Leiden, anticardiolipin antibodies, lupus. Those are all clumped together as clotting factors. Then the thyroid, I've mentioned, that must be tested. Prolactin must be tested, and one must look at the chromosomes of male and female, because that can impact on the embryo and cause losses. So we must know that the chromosomes are normal of both parties involved. Then one must do a hysteroscopy, check the uterine cavity for pathology. What is pathology? It means growths like fibroids, like polyps, like an abnormally shaped uterus. We call it a septum.
Yeah.
Those things can be corrected with the hysteroscope, simple instrument that will give the doctor the opportunity to clear out, to clean out those abnormal findings.
Okay.
One will then work out a plan for the patient and correct her cycles to make sure that she ovulates well, that the progesterone levels are good. And sometimes we put the patient on fertility medication for that. Add
Okay.
progesterone in the second half of cycle if necessary. And I
Okay.
think this is a short summary of a very big topic, but
Yes.
I will
Yes.
gladly talk in more detail if you wish to do that. There's
Yes. Yes.
4 minutes left, gone now. So I'm
Okay.
going to the male fertility side. And
Yes.
I thought that I'm going to do it very practically.
Okay.
We can do a very boring, long lecture on causes of infertility in the male and so on. But I'm going to work from the semen analysis because that is what the patient gets. And then
Yes.
from that, I will branch off and reflect on the meaning of a abnormal semen analysis. So, first thing again on the male is definitely a lifestyle history, and the same things apply that I've just mentioned on repeated losses. So, good lifestyle, no smoking. If you come to me, I say stop smoking. If you
Mm.
can't, perhaps you must find another doctor because if you can't help yourself, I can't help you.
Yeah.
So we of course with sympathy try to support the patient, give them help if they need help. But smoking can affect the DNA of the sperm, and that
Oh.
I always make a drawing of the sperm. The sperm head will look like an acorn, so it's an acorn, and inside the DNA there's a yellow dot that you see under electron microscopy. That yellow dot becomes totally black and sick
Wow.
of smoking and toxins, and one can change that. And that can, of course, cause infertility, but it can also cause repeated losses because the male can
Wow.
contribute to the abnormal embryo. So, lifestyle, 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 very important. And those are things that the patient can work on. You
Yeah.
don't need to be Einstein to suddenly realize. I always say to the patients, listen, they ask, what must we eat? I
Mm.
say to them, what God made. So, what does that mean? It means that if you eat a healthy diet and not what Tant Ali made or Tant Sari, what do they make? They make cake, Simba chips,
Yes.
um, certain types of chicken in deep fat. You know
Yeah.
the name of the brand and so on.
Yes.
So you ask yourself, is this natural? Is this coming from the ground or from a good grain fed cattle, uh, uh, live, chicken that is healthy? Um, then the answer is you can eat that. But the too much sugar, fruit juices, too much processed food, not good for fertility, uh, also on the male side. Um, now, they will come to you, and you as a patient will hear certain things are wrong. So, what are those things? Number one is we do a count on the sperm, and you can write down if you want to and say we talk about concentration per milliliter. So, in every milliliter of sperm, we want, and that's the normal. We want above 10 million, preferably above 14 million sperm per milliliter. So
Oh.
if you go below 10 million, it doesn't say you can't impregnate your wife, but we see it as an orange or red flag. Something is
Okay.
wrong. We'd say, example, 6 million per milliliter. Um,
Yeah.
I'll talk about that more later. Motility, that's the movement. We want at least 30% or more of the sample moving. So if you count 100 sperm, you want at least four out of 40% or
Mm.
4 out of 10 moving, not all of them dead. That
Yeah.
is a specific problem. Then we look at forward movement. So how strong do they swim? And that goes from 0, that's no movement, to 4, that's very good movement. Most men must have above 2. 2. Now, just for you to picture it, a 0 is no movement. 1 is a bicycle, example. 2 is a Volkswagen. 3 is a BMW, and 4 is Maserati. So we must judge the movement, and the doctor will say your movement characteristics are below the threshold or it's normal. Then we talk about morphology. What is morphology? It's the shape of the sperm. So I've told you a few minutes ago, if the spermatozoa are looking like a acorn, that's the ideal form. And there's a lot of stories that I can tell you about morphology, a very interesting topic. My whole life was spent around morphology and its prediction of fertility. So we want above 4% normal. So there are 3 patterns. 0 to 4 is called the P pattern, poor prognosis pattern. 5 to 14 is the G pattern, good prognosis pattern, good pattern. And then above 14% of the acorn type, let's say the guy's got 16%, then he's in the N pattern. So if someone is in the P pattern, of course, immediately that history comes into play. What is the lifestyle issue? What drugs are he's on, and so on. So when you see an abnormality, you reflect back to the patient. Also, the examination of the patient, which I will talk about later. Then there's a test in the semen called the MAR test, M-A-R test. That will give us an indication if there are antibodies in the sperm. So a male can have, after injury, for example, antibodies can develop. And if the antibody test is below 50%, it's normal because you find antibodies, but that's a low percentage. But if you have above 50%, some say 80% a big problem of a MAR positive, then you need to do another test to see what type of antibody is sitting on the sperm. I'm not going to go there. That's more for the doctor, and he will then explain. We call that the immunoB test. So MAR is a screening tool to make sure no antibodies, or yes, there are antibodies, and then we will. Now, I just want to make a point. If you are below these parameters, it doesn't say you cannot impregnate your wife. You can, but your statistical chance is lower. And that is where the female comes into play. We don't see the male in isolation. The female can perhaps have an irregular cycle. Perhaps she is smoking. So if she stops smoking and we regulate the cycle with clomiphene citrate or letrozole or something, her fertility goes up. And although he's below the threshold, he impregnates her. So one must see the couple as a unit, and one must not be absolutely dogmatic on the sperm. Now, some men can have no sperm. So even if there's no sperm, you wait a month and you repeat the sample again, because stress can cause sometimes a 0 count. Yeah. And then next time it is normal. So one must also be careful to go on one analysis and say you've got no sperm, and so on. So let's start with the no sperm. I just want to look at the time now. We're 12 minutes now. I will talk 3 minutes more and then I'll stop. 2 minutes more. So azoospermia, that is the no sperm. And if there's azoospermia and you do a repeat and it's still like that, we need to try to find out now why. Yeah. Can I just close the door here? I'm sorry.
No worries.
that just gave you a little breather. So
Okay.
in short, azoospermia, you must do chromosomes on the male because sometimes there can be a chromosomal reason. The short arm of the Y chromosome can be lost, and that causes azoospermia. So there's a lot of chromosomal things that one must exclude. Then we do the hormonal test. We do a FSH on the male and a testosterone level. And the FSH is an indicator, is the testis working or not? If the testis is working well, one can then help the patient, the male patient, with certain medication. So that's treatable. If the FSH is like 30 or 40, it says this male, we can't treat him medically, but we can still find sperm in the testis. And they need a testis biopsy, but at a fertility clinic where they can freeze the sperm if they find that. And those sperm can be used for in vitro ICSI treatment, where we inject the sperm in the oocyte. All right. Now, if we come back to the physical exam, always after you've seen the patient and get that history, you do a physical exam. Why? Because you want to exclude varicocele. Varicocele in Afrikaans is a spot R. A varicocele is usually on the left side of the left testis. It feels like a worms around the testis, and that can be removed with a small operation, and you remove the varicocele done by a urologist, and that can improve the count from 0 to a count visible, or a low count can become normal. So it is important to exclude any physical abnormalities. I think, there's so much to talk about, but I thought we'll just start and perhaps one can do follow-up discussions on this, but we start with the lifestyle. We reflect on the semen analysis. We reflect on the male with no sperm. We reflect on the physical exam, that must be done. Then a good tip for enhancing your sperm quality is that change in lifestyle, and then add zinc 40 milligrams, vitamin C 300 milligrams, and folic acid to the husband's supplements, and that can also help and improve quality. There are many drugs on the shelves. Don't just go for the first thing saying it can improve this sperm. Usually it can't, but what I've just mentioned can be helpful, very simple and very cheap.
Go ahead,
I think I'm going to stop there for now, based on the time available.
Yes. So thank you very much, Professor. I'm actually just busy looking at the messages that's come through. There has people are asking about hypertension and PCOS, but I think that is another topic. And today we're just going to focus on the male infertility.
I can answer that if there's time. You can see.
Yes. So one of the questions is, hi, Professor, I have hormonal hypertension due to PCOS. Does hypertension meds also make that you don't ovulate? And she suffers from migraines as well.
Yeah. So usually, not always, usually patient with PCOS is overweight often, and they must lose weight. That will correct the blood pressure. If she wants to fall pregnant, the correct antihypertensive must be given. That must be discussed with the gynecologist, saying, I want to fall pregnant, that they start her on the correct medication, because all hypertensive drugs cannot be used in pregnancy, but we must correct before pregnancy.
Yes.
So there's one, alpha-methyl-dopa is one type of medication that we know very well, but your doctor will know, and you must discuss that. What was the other thing? Hypertension doesn't cause the polycystic ovarian syndrome. It is a hormonal imbalance.
Yes. Okay. So another question is, what would you recommend as a good medication for PCOS?
PCOS, if you want a baby, because
Yes.
that's what we're talking about,
Yes.
then the number one lifestyle,
Yeah.
number one lifestyle,
Yeah.
number one weight loss,
Okay.
and take that very serious. See a
Yeah.
dietitian if the weight is a problem. But
Yeah.
if the weight is not a problem, then she can still have PCOS. The idea is to get them to ovulate, and there are two options in the beginning. You try to get the right dose of clomiphene citrate or letrozole uh,
Yes.
drugs, two options. Some patients go on metformin to assist the insulin resistance
Resistance.
part of their uh, disease. All those are correct, but must be done under the jurisdiction of a fertility
Specialist.
specialist, preferably if the gynecologists do not get it right, because sometimes it takes a lot of time. Patient must also be followed for long enough in a cycle. Average women will ovulate on day 12, 14, but these patients often ovulate on day 20, 21, and one must realize that you must watch over them, do ultrasound scans later to see if she's not a late ovulator. That's in
Yeah.
short. Yeah.
Yeah, I've got one more question. A lady's asking, Natasha's asking, good day, Professor. I'm also trying to have a baby. I've been to gynecologist and everything is fine. So I don't understand what is happening. It's been 5 years now. But this is something I get quite a lot. And that's exactly what happened to me. So for year after year after year, I kept going to a gynecologist and we do everything. And he says, no, everything is fine. You just have PCOS. Let's just put you on Clomid. Go on Clomid and back and forth. But I was never told you need to go to a fertility specialist. Only when it was almost too late was I told you need to go to a fertility specialist. So women, that is why we have the platform to try and tell women, don't waste your time. And I'm not saying no offense to any gynecologist or anything. Yes, go and do your initial consultation at a gynecologist. But when things are not working, go and see a fertility specialist. This is what they specialize in. Infertility, not being able to conceive. And don't waste your time going back and forth and just being told everything is fine, or they just go to a clinic and get told,
I,
oh yeah, just come back. Yeah.
I agree with you, but I can be more dogmatic and say that if you're 28
Yeah.
and you have irregular cycles, you suspect a PCOS, go to your gynecologist. They can correct. And
Yeah.
if you're not pregnant, at least in 1 year, you need to move. If you are
Yes,
35 with the same complaint, you go
yeah,
directly to the fertility specialist.
that's
Why?
correct.
Because your time is the factor. And if you get to 38, 39, it's difficult to get pregnancies quickly.
Yeah. Well, just I've got one last question, Professor. What would you say is the cutoff age for anyone trying to conceive on the women's side as well as the men's side?
You must be more specific. What do you mean? Tell me better,
So,
because I can just say briefly, broadly, and then you rephrase. People wait too long. In this modern age, they have
yeah,
their careers. They come to the doctor when they're 37. They postpone their families. So
yeah,
people, if possible, must have their children before 30, before 35.
yeah.
That doesn't happen. So that's just a broad outline. But tell me
Yeah.
in more detail what you're thinking.
Okay, so what I'm actually thinking is that, okay, so I'm 39 years old. Is it too late for me? And I suffer from PCOS. Would you say it's too late for me? Because, to try and correct things or go on the proper medication? Because I'm seeing a fertility dietitian at the moment to try and correct things. And would it be too late, me being 39 years old, to try and now conceive?
No, the answer is no, but you must move. You must work with a dietitian and your fertility specialist parallel. and don't wait. You go there and you work with your dietitian. That's the right thing to do.
Yeah.
But you don't wait until you're 40. Now you go to the gynecologist. You go
Yeah.
immediately that they can start working with you too. Not too late,
Yeah.
but it's
Okay.
late in the day.
Yeah. Okay. Thank you very much, Professor. I don't see any more. If they are, if you would love to get hold of Professor, you can email. You can contact Aevitas Fertility Clinic. I will put their details out there, and we do promote them all the time on our page as well. So look out for that. So contact Aevitas Fertility Clinic if you have any questions for the professor. I'm sure you wouldn't mind answering it. And we just like to thank the professor. We hope to have you back soon again. There are so many things that we would love to discuss with you, and it's been great.
Yeah, I think thank you very much for the invitation. Much appreciated. I think we've just scratched the surface on the male and scratched the surface on the repeated losses.
Yes.
So in future, if you want to, we can talk,
Definitely.
a next step and a next step, and that will give the patients more insight, your listeners. Thank you. Really appreciate it, and have a wonderful day.
You too. Great. And happy birthday to your wife, Professor, and I hope you have a great day further. Thanks.
I want to wish you and the listeners one. I've got three things to say. One, may God bless you, and Inkosi Ibinawe, and in Afrikaans mag die Here julle seën, because that's what we need to fall pregnant.
That's good.
Thank you.
Thank you, Professor. Thanks.